food can have an incredible impact on health, both for the good and the bad. And getting the diet right is so critical. Hey, I'm Dr. Ruth Roberts, the original holistic pet health coach, and with me today is one of our very first graduates, Maggie Shellhammer, certified holistic pet health coach. And Maggie has got a super interesting story to tell you. And I think that you're going to appreciate this because it's a really, really timely topic. And that is what happens with Lyme disease. And so she has sadly had this experience with one of her own dogs, Vito. Maggie, why don't you give us a top level synopsis of what you and Vito have gone through figuring all this stuff out?
Sure. I was in the habit of every 6 months, I think, I would take all my kids to the vet to get heartworm, Lyme, a full blood panel, and urinalysis. Like, just run those tests twice a year. And I've learned now that you just keep doing that until you get a positive. Because as it turned out, little Vito came back as positive for Lyme. Um, and I've learned a lot along the way because I found that initial test lets you know that he's been exposed to Lyme. And I've had a lot of experience pulling ticks off of my dogs. It's just where we live. We've got 56 acres total. Not that they run on 56 acres, but it's going to happen. So I just do what I can to prevent the ticks. But sometimes they get that one that's infected and bites them. Keeping up with the testing helped me to detect this as soon as possible because I believe, and correct me if I'm wrong, it takes 3 to 5 weeks or something for a positive test to show up after that initial tick bite. So we knew at least that it had happened within the last 6 months of that time. So catching it early was good. And then I went on to do advanced testing to see the level of exposure, to see if there was an active infection. And that's been an ongoing learning experience.
Experience. And let's talk about those two tests. So the first is a screening test, and that's like the 4DX test that vets do in office, right? And it's a little thing that you put a drop of blood in, the blood comes up to a certain point, and then you bam, in the office, you push it down, and that puts some fluid through so that then the test can then run. So it's a screening test, and you're absolutely right. It's a positive for Lyme there means exposure, and also it can mean vaccination. So it's okay. Now what do we do? And then the other test you mentioned is a Quant C6, and that's supposed to be a confirmatory test, or CD6 is the other one. I think that just is a trade name for this specific test. In this process, so you got a positive test, and how was Vito feeling? Was he feeling okay?
Vito told me nothing about Lyme disease. He did not have any symptoms. Typical is lethargy or loss of appetite or joint pain is a big one, and never saw anything. So I would have assumed, if I didn't know any better, my dog's healthy. He has no problems. So we did the Quant C6 and tested the antibodies. And Vito had not been vaccinated for Lyme in his life. That was my personal choice. So we knew that we were dealing with the actual bacteria from a tick. And then that came back not super high, I feel like. Or maybe it was high, but there were no signs of infection. The white blood cell count was low. Other inflammatory markers were fairly low. But on the blood work and urinalysis, we were keeping an eye in the meantime on kidney function because that's something that the Lyme bacteria can have a massive impact on, are the kidneys. And those were the numbers that led us down this rabbit hole of continued testing.
And that's the really frustrating part, right? Because And this is what happens in people. There are some folks, they get the bullseye, they follow the whole directions of how it's supposed to happen, and it's crystal clear what needs to happen in terms of treatment and support for these folks. But there's a lot of people that just all of a sudden they show up with some really gnarly inflammatory disease, kidneys, heart, etc. And then it's like, okay, where did this come from? So
And there,
you're in a lucky spot where you actually were able to know it was there and prevent it from turning into a disastrous situation.
yeah, started tracking it from the beginning. And that's the interesting thing about people versus dogs, from what I've read. It seems as though 95% of people have that telltale bullseye bite mark, and they're like, oh, I need to go get checked for Lyme. Or on the other side, if they didn't have any symptoms immediately, years from now, they start having those symptoms. They're not thinking about, oh, right, I got bit by a tick uh, back in 2005. Um, but for dogs, only 5% of them have symptoms. And it can take months or over a year to see those symptoms. And again, you're not thinking about that tick bite because it's in the middle of winter now or whatever. So, not sure where I was at.
No, it's all good.
Sorry.
So that's the thing, right? Because this is how confusing Lyme disease is. And you have been doing tons of research. You've got some education about what happens with it, but it's really is confusing. It's Rocky Mountain spotted fever, for instance. That's where when people were going west, the pioneers were going west, that's where they showed up with it, which is this is another tick-borne disease. But where they actually got it was like in the Michigan, Illinois area. And it just
Very
took
different.
that long for the symptoms to actually show up after the tick bites. So
Fascinating.
that right on. Yeah, so that's the whole deal. So here you are. Now you've got a dog has the bugs there, Borrelia burgdorferi, and now you're seeing kidney value changes. So then what did you guys do next?
And now, a year ago, initially, when we very first got our first Lyme positive, we did the C6, and that time there was an infection present, so we did the antibiotic. This time, so this, by the way, is the second exposure to Lyme, re-exposure. He likes to be an overachiever, as we find out. But this time there was not that apparent infection. So what I chose to do, we had elevated kidney values and just showed inflammation in the body. So I chose to do supplementation with herbs and try to bring those support the kidney, try to bring that number down. And inflammation, he's already on an anti-inflammatory diet. Just the crock pot diet by nature is an anti-inflammatory diet, but I was adding in whopping doses of omega-3 fatty acids and added a humic and fulvic acid to try and pull out the evils, whatever I could. And then in a month, we planned on rechecking to see if it worked. So it didn't entirely work, those numbers, but they maintained exactly the same. But the interesting part is this time we had an infection. So somewhere, and that's where we're in the midst of finding out what kind of infection, because Lyme can be a chronic, it can show up chronically on this lab work. But if he has a kidney infection or a UTI, we need to know specifically what we're dealing with before treating. So more tests.
Exactly. More testing. And it's just a pain in the behind. And I'm sure Vito enjoys it thoroughly.
Right. Yeah, he's getting really good at going to the vet. And each time I tell him this should be the last time. I'm going to stop telling him that. I'm getting his hopes up too much. But he's such a strong boy. And that's the thing, it's hard for me to explain to people. This has been ongoing since April. This time around, it's been ongoing since April. Now it's June. I don't second guess myself on doing these further testings. I could have done an antibiotic, just a general overall antibiotic 3 months ago, 2 months ago. but I wanted to learn more. And that's part of being a student. I wanted to learn more and know what I'm talking about. But it's possible we could have done that antibiotic 2 months ago and then found out now that we needed to do another one. So then he would have been, by the end of it, on antibiotic for 3 months straight. We're avoiding that. And I can do that because and we're not in the red zone, danger zone. So
Right on.
that's what I want to let people know is that it does add up, but we're making sure we do exactly what he needs to fix the problem.
Right on. And I think that's critical because that's the general consensus at this point is if there's no symptomatology in terms of the joint pain, the fever, the malaise, any of these other things, then the general consensus has been in conventional medicine to hold off on doxycycline or other antibiotics. But something's going on in there. And so is it the Lyme disease or does he just have a gnarly infection? Because what showed up was some elevated white cells in the urine and then a particular type of white cell that indicates chronic inflammation or infection in the blood. So again, we're still not really sure what it is. Is it the Lyme? Is it something else going on? And so that's the difficulty is, yep, there's a positive test for Lyme, but should it be creating a ton of white cells in the urine? That's not a normal outcome. So this is where you're getting really, if you need to use an antibiotic for this guy, you're going to have a very specific answer as to what antibiotic is needed. Plus, you've got all of this other stuff on board protecting him from inflammation, from the adverse effects of Lyme disease, and setting him up to deal with the antibiotics without decimating his microbiome, which is just absolutely critical. So if somebody's, oh my gosh, all of a sudden the ticks are off the hook this year, and that is, we keep hearing this really frequently, then what do you suggest people do in terms of monitoring their pets, testing, all of that stuff?
On a daily basis, if you want to go the natural route, you're just going to have an arsenal of things that you use. I have 2 different sprays. Like pre-made essential oil sprays. I have just an essential oil blend that I rotate. I got the amber collar this year for the first time. I needed to add something new in because they're just relentless. And things in their food, the controversial garlic, but my dogs do fine with garlic. I add extra during tick season and it helps. Frequent bathing, that also keeps them clean and makes the ticks not detect them in the grass.
Wait a minute. You mean garlic's not going to kill your dogs? Sorry, I just had to say that.
That's why I say, warning, this is controversial topic, but I give them a ton. And I shouldn't say that. It's for a batch of food that lasts 4 days between 3 dogs, I put a lot in that batch of food. So we can talk about that during a consultation if anybody wants more information. But I do all those things. And the one thing that I was missing over all these years,
Mm-mm.
all these spring times and summer times of ticks, frequent tick checks. That's like it seems like the most obvious thing, but I'm a dog groomer and people come in all the time and say, I just found a tick on my dog. And I'm like, okay. And how long was that there? And they're like, I don't know. I don't look for these things. And I said, yeah, you have to check. And I'll find them on a dog right near their eyes, near their mouth, near their nose, where people are constantly in their dog's face and you miss it. You you don't expect to see it, so you don't see it. So frequent tick checking, very important. And I started with my dogs. I was bad about it over the years and I kept adding to my arsenal. Oh yeah, maybe I should look harder. Catch
Oh,
them
that.
that same day.
Right on. And that's the thing with the little nymph ticks, those things can be
Oh,
super hard to see. Yeah.
so tiny.
Yeah. All right. So you're tick checking, you are using essential oils, you're using Baltic amber color. And just literally going over them with almost a fine tooth comb. And that's, in full disclosure, Vito is a pug. So that hair
Right.
coat's a little bit tough to deal with too, isn't it?
It it's a thick coat, and you think that, oh, they're short-haired dogs, you should be able to notice. Because those ticks, they just crawl really fast and dive under the hair. You're not gonna find them until they're fat. So you really have to dig in, and fortunately, when a tick jumps on them and they're not even sure if, like like I said, I keep my dogs clean and I spray them. So a tick at first isn't quite sure if this is an animal or not because it smells so beautiful. And I'll see them crawling across the fur. And that makes it easy. I just pull it while we're still outside and dispose of it. And yeah,
That's really cool. So you can basically keep them, the all of that stuff will keep them on the top of the fur coat. So you can basically sweep these things off
yeah.
into a jar of alcohol waiting to bring them to their end. That's amazing. And then you mentioned some of the things you're doing to help support their immune function. And that's awesome. I want to backtrack for a second about garlic. And I think learning what to do specifically, but Sheila, yeah, garlic is a dose dependent thing and it is toxic to us as well. But generally, we're not going to eat enough. So, what do we serve? Like a 50-pound dog can eat one raw clove per day, but there's a lot of flea slash tick supplements that utilize garlic. So, are you using
Right.
fresh garlic for the most part, or cooking it in, or how are you doing?
I only use fresh garlic into, like, I mince it into the batch of food and then cook it. And that seems to work well. I never thought about it. I probably could use less if I put it fresh right onto their plate, but it works well cooking it into their food. But like I said, I load them up during tick season and then pull it back during the winter time. But fresh, I think that they would eat it. That's the thing. Your dog, you just have to find out what your dog likes. I have pugs that usually do not say no to anything that I give them.
Right on. That helps a
They
lot
trust
too.
me. Mhm.
Yeah. And then cooking will decrease the toxicity as well. So, fresh definitely is more potent, but yeah, cooking it adds some of the safety back in there. So, and then in talking about, you mentioned some of the things in terms of making sure that you're feeding an anti-inflammatory diet instead of a pro-inflammatory diet. So,
Yeah.
what is a pro-inflammatory diet?
The most pro-inflammatory diet is the most ultra processed that you can find. So dry dog food, just by the way it's cooked at very high heats multiple times. So it's good and dead by the time it comes out of the machine. And that just, and it's high carbohydrate within the ingredients of that food, more inflammation or inflammatory response to that sort of thing. The high heat, and it creates those AGEs, the advanced glycation end products. I'm sounding smarter than I am. With
You're
these,
nailing it.
but these are all inflammatory molecules uh, that are created just by the way that dry food is made. And then the next step would be to go to a canned food. At least you're adding moisture to the diet. But the AGGs or AGEs are high in canned food as well. You're not really getting better product from that, but you're getting moisture. So that's when we try to encourage people to start adding some real food, fresh food, as much as you can. Take a tablespoon of kibble out, put in a tablespoon of fresh. Just start. So yeah, that's the ultra processed and down the line to until you get to real food.
Right on. And that's just so critical. There was a really interesting paper using actually fresh diet. And what they showed was that the diversity and richness of the microbiome improved dramatically. And really interestingly, and this is in healthy dogs, but really interestingly, epigenetic changes. So the way the genes process and code for proteins reset to more younger levels just within 12 weeks. And so, what they always say in a study is it needs more studies, which in this case is true because they're dealing with healthy dogs. So, how would that impact dogs that were not healthy? And this is the difficulty is finding a group of people with dogs with serious health issues where you're making only one change and that's diet first. That'd be a pretty tough commitment. But we know that food can have an incredible impact on health, both for the good and the bad. And getting the diet right is so critical. That's part of what we teach in the holistic pet health coach certification program. But what have you found with some of your clients in terms of when you start to work with them, what you need to do to help them adjust their pets' diets?
It's like I was mentioning already with taking a tablespoon out and adding a tablespoon. You need to go slow and figure out what you're comfortable with, and we'll work with that. But the nice thing about it, the baby steps, is that even with those baby steps, you start to see changes, positive changes in their skin and their coat. And tying that to what you just said, where it's improving that gut microbiome. And nobody wants to hear the word microbiome, but this is the gut is where your immune system is. And everybody likes to say the word immune system. Like, that's so important. You need a strong immune system, and your immune defenses are low, you get sick. So it just makes sense. You're gradually making that immune system stronger. It's going to fight off disease and inflammation. And that's the most important part, where the inflammation leads to disease. We can control that now. And it's hard to get people to jump in all the way. I don't try to tell someone you need to be cooking for your dog. That's it sounds crazy. It's not once you get started, but fresh food. That's it. And then from there, if you work with a coach regularly, you can now try this. Now try this. And we'll get your dog to this great place where you have the real food as your base and you're only adding in a couple of things.
Right
I
on.
try to keep it as simple as possible for my dogs. I have overloaded them in the past where I had the 10 different things. And I'm like, wait, this doesn't even make sense to me. So brought it back to food and then used the supplements as each one needed them. And they're all on different things for their own particular needs. I don't know if that answered your question or not, but
It did. And that's really part of the wisdom here is that you go, oh my God, my dog has Lyme. And you can go searching online and find all of these kits for Lyme disease with, and then what we have seen in the past is people will buy two or three of these kits because they want to make sure they're really doing a good job. And then they've got supplements that are overlapping. Many of these Lyme disease kits actually contain herbal medicines that they're plant based. That's amazing, but they are antimicrobial. They're still going to impact the microbiome. And so that's kind of part of why we want you to take a deep breath. If you get some bad news at your vet or you're trying to sort out a health problem, and really go back to what's at the root cause of this thing. And so, an infectious disease, we can say, yeah, he got the infection from a tick, but ultimately, part of the reason is that there was some chink in the armor, so to speak. The immune system wasn't able to sufficiently fight this off. And I think you choosing not to vaccinate for Lyme is not unreasonable because many of those dogs still get Lyme disease, plus
mhm.
all of the other tick-borne diseases, which is super frustrating.
Right,
So
and
it,
we've had that in our house too. We've had another dog with a different tick-borne, and Vito, the overachiever, he not only had a positive Lyme, he had a positive anaplasma or anaplasmosis.
yeah,
Yeah, he likes to impress us. But it's whatever it is that it always comes back to that strong immune system to fight off, like you're saying.
exactly. And so that's part of it is culturing the terrain, if you will, to be as supportive of the body as possible. Yeah, that's critically important. So we've got a couple of questions from over in Circle let's see if I can pop this up if I'm smart enough to do it. Oh, goody. Today I'm smart. Let me see if I can screen share a little bit. So here is the dreaded flea and tick question. And
Popular
that
one.
is, it's the season right now. What's everybody doing for flea, tick, heartworm prevention? This person, Christina, lives in the South and the mosquitoes are dreadful. They're getting their commercial treatment, but she's worried more about the heartworms right now. I think you mentioned a few things. So you are using a lot of essential oils, which is great, and the Baltic amber flea collar. But
Mhm.
any advice for Christina in terms of fleas and heartworm
And
especially?
the heartworm I was going to touch on, that's something else. I also have kind of a different blend of sprays for mosquitoes just because they contain like peppermint or lavender or something that's more specific to, and citronella that's more specific to not attract mosquitoes. But also just time your day and make sure that you don't take your dog out at dusk when they're most active. Try and get them out before the sun starts to go down, and then maybe not until right before bedtime. You just have to do those sort of things. But I don't treat in any other way for heartworm. I don't recommend to people anything that the vet has to offer because I don't use it. I test. And that's where I feel is the best answer you're going to get is on that lab work. So you don't have to worry about your dog getting heartworm because if you detect it early, and if you start now and you do it, I say every 6 months, if that's too much, every year, but you're going to still be able to catch it pretty early and treat it at the time. And it's not as scary as people think if it's not progressed too far. It- People picture the spaghetti picture that they've seen in the vet's office where they try to scare you. This is awful. You don't want this to happen to your dog. No, I don't want that to happen to my dog. But that took years. That took years for it to look like that, or at least more than 1 year. I don't know. I don't know how long
Yeah.
it takes.
Yeah,
Don't be afraid of the heartworm stuff. Those repellent sprays I like the most, and test regularly.
that's all good. And I think the repellent sprays are really important because if we can keep the mosquitoes off of them as much as possible, that really helps. Now, if you live in the Southeast and you've ever seen a dog with heartworm, it is not fun. And while we can use slow kill method and that kind of stuff, it still is a bit taxing. So another option would be to use either a heartworm nosode, or there's Amber Naturals has a great product called HWF that helps clear non things that shouldn't be in the circulatory system from the circulatory system. And then the other thing that's really interesting is the heartworm prevention itself. It's almost impossible now to find just the heartworm prevention that's not combined with some sort of other antiparasitic drug. So many people will try to find the least amount of stuff in that particular medication. But if you go to the American Heartworm Society, you can uh, go and read about their recommendations. And currently, it's to give the heartworm prevention every 45 days. And remember, when you give heartworm prevention, it's going to backtrack from the 45 days prior. So that's another way to look at it. And then it has to be above 55 degrees at night consistently for the heartworms to really be an issue. So there's a lot of options out there, and I think you have to decide where your comfort level is to make your life easy. Because if it's something like, okay, I'm just going to test every 6 months, but you're constantly worried, then that worry tends to bring on things we don't want to have to deal with.
That's
And Sheila, yeah, does that make sense?
Yeah, yeah, good point. We don't want to add stress because we're thinking about it all the time. So whatever
Right
makes
on.
you feel comfortable with what you're doing.
And no-sodes, I know just enough about to give you some information, but to be fair, I don't know the best options to find them. Will Falconer is a veterinarian that is a classically trained homeopath. I think he had some options on his website, so the Vital Vet. So check that out. And our other fun things. There was a post about something called the quercetin paradox. And Laura, thanks for bringing this up. Have you heard of this, Maggie?
I actually have not. I saw that one and I didn't know what she was referring to.
And to be fair, I had not really dug into this as well. It's interesting because I've been taking quercetin for years at really relatively high doses, and we've seen dogs take it really well. And so, what this is the fact that quercetin long term can have some metabolites that are toxic. And so, if you don't have other things on board like vitamin C, or there's deficient glutathione or N-acetylcysteine, so basically things that help the liver get rid of the toxic metabolites, this can end up creating an issue. So I think that this is interesting. And probably if your liver function is not super fantastic, this may be a concern. But generally, if we're using quercetin, and especially for dogs with allergies, you're using it along.
Shoot. It looks like we've lost Dr. Roberts. I'm sure she will be able to jump back in really soon. Um, I wonder if I can see comments. Excuse me. Was not planning on being the hostess. I hope I don't have to be for long. Somebody asked me a question. Hmm. I am so sorry, everyone watching, for the dead air. There we are. She's back. Yay.
Sorry about that. My internet just got tired. So I was
Oh,
babbling on about quercetin paradox. I'm not sure where I disappeared. But at
the
any rate, so
liver function, if the liver function is not great, you should
got it.
maybe avoid it.
Yeah. So I think that's going to be super critical. But if your dog's got something that's creating distress and inflammation in the body, you need to be doing multiple things at a time. But what's interesting is that I've used it long term. We've had many pets use it long term with histopause, and that's nice because it's 200 milligrams of quercetin plus 200 milligrams of stinging nettle. So it makes dosing smaller pets much easier. And there's some information on dosing on the website there, but it's that's been just our go-to for allergies and interestingly for kidney support. And there's also a lot of evidence that it's amazing to use in terms of supporting pets with cancer too, because it is such a powerful antioxidant. So cool. And looks like you're getting quizzed in my absence.
I said somebody asked me a question because I didn't know what to say.
You did
So,
it. Yeah. So cool.
oh, what part of the country do I live? I'm in Northeast Ohio. So we have a pretty heavy tick season, and this winter was fairly mild, so the ticks didn't really die, and they quadrupled this year. It
Ooh,
seems like.
yuck. And
And
how happy are you with the amber collar? And have you tried other versions, other collars?
yeah, I try not to say it out loud too frequently because I don't want to jinx it, but I just started the amber collar this spring, and I think it's pretty amazing. Now, I had all those other things in place already over previous seasons. I had collected what I felt was working well and ditched what wasn't. But then at the start of the spring, I'm like, here we go again. And they were just on the dogs. So I said, okay, let's try something else. And that amber collar it really has minimized the amount of ticks that are latching onto the dog or even jumping onto the dogs at all. But we've also been 1 full year since the last not 1 full year, say 6 months maybe since the last tick season. And I'm always working on their diet and making sure that they're in good shape, boosting the immune system, always making the tweaks where I need to. So they come into tick season pretty healthy, which also helps. But I do the amber collar. I'm going to keep those. I think you have to buy them every year, though. That's what I'm finding. I don't know if you have any experience with them, Dr. Roberts, but I feel like they need to be replaced.
I think even sooner than that. So I've seen everywhere from 3 months to 6 months. So the way they work is they generate an electrostatic charge. And I
Mhm.
think part of the way these collars are set up is that they look like little pieces of the amber that's been strung together. And the difficulty is that they will break up a little bit. So as they start to break up, then I think that charge isn't quite effective.
Right. Yeah, but they're pretty too. Little necklace for your dog. I
Yeah.
mean, it's worth it.
I,
Make them look
I
cute, anything.
yeah, I've actually worn the extra large one out to an event. Just it
We've
was a dog event. It was a kind of a joke.
I've had moms see those necklaces on my dogs and they say, "Oh, I used to put those on my kids for keep the ticks off of." I'm like, "Yeah, same thing. Does your dog have one?"
Right on. And that's the another thing you can consider too. I don't know if you've done this, is beneficial nematodes.
Mhm.
Those can be helpful in limiting some of the nymphs. Have you tried that one?
So I
Not
love
so much?
nematodes. No, I don't put them in the ground myself. I don't want to throw my husband under the bus, but it's his job, and I buy them, and they sit in our fridge, and then they expire. So you have to put them on the ground, and then they'll work great. So ours, that's the thing. We haven't used them in the last couple of years because they didn't get put in the ground. But when we did, way less flies around our house, around our roses. It's just to speak to the ticks we can't really cover because our property is so vast, and that's where the ticks are in the tall grass. But up around the yard, the things that I noticed weren't happening. There were less flies, there were less ants, there were less. So I know they work, and if you have a yard, especially a fenced-in yard, I would use those every year, twice a year. Just keep them coming, and you'll keep all the bugs and all the fleas and ticks down because I know it works. Unfortunately, it doesn't battle ticks for my dogs because they're out in tall grass where we can't spray unless we had a small plane.
Right on. Yeah, exactly. So yeah, you have to get a drone to spray this stuff for you, right?
Right.
So yeah, Liz, exactly. So as the beads break on those collars, they may become less effective. So keep an eye on those. And so this is the Baltic amber collars. And then we were chatting a little bit about the beneficial nematodes, which are you can get from a lot of different sources. So if you Google those, you can check that out.
And
And
I would go ahead
yeah,
and throw out Arbico Organics. That's the brand that I like. They have 3 different, they might even have more than 3, but there's a 3-pack that you can get. And if you look at the list of all the insects that it takes care of, you can find exactly what you need for what's prevalent in your yard. And you can pick exactly the ones. It's a good
wow,
brand.
that's cool. So it's even they're targeting specific bugs. Yeah. Yeah, that's amazing. So
Yeah,
I'll
so if
post
something's
that there.
eating your roses in your flower garden, then you can make
Yeah,
sure that's on the list.
right on. Yeah, and the
Where
Catan dog tag, yeah, that's supposed to take care of ticks and fleas as well. but they do. So this and the zero bug zone, they have to be on 24/7. And if you, I think the Catan tag, it takes 30 days to reach efficacy. And so if you take it off to bathe the dog, then you have to start all over again, which is a little frustrating, but they are quite effective. Oh, that's cool. So you can put amber collars in the sun to recharge them. Awesome. It's
I have
amazing.
heard that too.
Cool. Well, cool. We've got, I think, time for one more quick question, and this one is indeed a bit heartbreaking. But I think it, let's see if I can get here. So this is from Michelle. And so the long story short is they've got 4 dogs. They went on a ramp got loose in the neighborhood, and one of them, Sadie, got picked up by animal control, but they had to vaccinate her against rabies. And unfortunately, sometime after that, then they got into a fight and went over the top. Now they're fighting all of the time. They're screaming at each other. She seems to be attacking him for just looking at her. And then Duke, the other dog, was taken by a friend to see if they can rehome him. So she's currently under lock and key because she's afraid that Sadie will attack one of the labs because Duke isn't there. So this is timely. I was researching Lyme disease today and noticed that a lot of her symptoms could be Lyme. So what do you think, Maggie? Wow, that is tough.
That is a heck of a situation. And it's interesting that she got the rabies vaccination and then things started going weird behavior wise. So there's definitely something to that, but she also says the symptoms sound like Lyme. I wonder what symptoms she's referring to and how long those have been that she's noticed. Is this something
Right.
new or something that's been ongoing and now the behavior's off?
Yeah, it sounds like there weren't really, it's just this really marked behavior change. And that's not really something I would think of in terms of Lyme. Would usually we're
I
seeing, yeah, much the ones you described right at the outset was lameness, pain, lethargy, all of that kind of stuff. So that I wouldn't associate with Lyme. I'd be suspicious about that vaccine.
Yeah,
And
it sounds like a
especially,
reaction.
yeah. So one of the things that you may or may not have had available to you at the time is thuja, Michelle. And so this is one of the great sort of detoxification remedies in homeopathy. And so that's where the rebalancer from Adored Beast can be super helpful. This is where I think you've got a whole host of things to do, right? Because some insult has already happened. One is you want to really do what Maggie was talking about, control the inflammation, get things under control, and then use this rebalancer to help reduce the toxicosis. So I think that at this point, what I would generally recommend would be to use this for 21 days. But this is such a severe and over the top case of problems that this is where working with a holistic pet health coach will be super, super important. And Chantel, if you can help us out and drop a link to where folks can contact Maggie to work with her, that would be amazing. But this really is too closely pulled together for comfort to
Mhm.
me. Is that kind of your best
That's how
guess
it
too?
seems, and especially since they were all such good friends up until now, the dogs loved each other and snuggled and all that. So definitely something's off in the up in the brain there.
Something ain't right. Yeah, yeah. But that is heartbreaking. And I cannot imagine being in that position. I've had dogs that fought, but generally it is not a big issue like that where it's so sudden. So I'm gonna add a link to where you can find out where to work with Maggie because I think this is really critical. And the other thing is that if you are at all interested in learning how to be a holistic pet health coach, I'm going to drop a link here as well so that you can find out more information. We are having a live webinar next Wednesday at 1 p.m. Eastern. I'll be there doing question and answer, so that you can learn about the program. Some of our coaches will be there so that you can ask them about their experience. I'll be teaching on what I think is one of the most important causes that we're not really talking about in terms of chronic disease that is out there. So check that out. Click on that link for the Holistic Pet Health Coach and learn more about the program. If you are in a position where you're struggling with trying to figure out what's going on with your dog's health, this is where working with a coach like Maggie can be incredibly beneficial, because you need that guide sometimes, because you can go online, read about all sorts of stuff and just be like, I don't know what to do next. And this is where you can help people walk through, okay, when did this start? What's going on? All of those good things.
Yeah, more questions that you don't have time in the vet office to run through all these questions. That's where we can take that extra time.
Amen. And that's so critical, because it is so frustrating on both sides of the exam table. I think veterinarians are incredibly frustrated that their exam time has been dropped down to 6 to 12 minutes. And then you, the pet parent, you're trying to get the answers you need, and you just cannot get that in that period of time. And
This is our problem child. He just wanted to introduce himself. This is Vito. Okay. Go
aptly named. Aptly
All
named.
right.
Cool. Maggie,
Okay.
thank you so
Amen.
much for joining today. It was always a pleasure, always a
Really?
delight. You guys
Yeah, this was
know
great.
where you can go get help. Cool. Good. And keep us posted on how Vito does.
I will. I will. Fingers
Cool.
crossed.
All right. Amen. All right. See you guys next week.
Thank you.
Thanks.